Hi, I'm Steve Knighton from Nottinghill Family Wellness Centre. Today we're going to go over a TL or a QL injury. And what those are your thoracic lumbar junction and your quadratus lumborum muscle. So our patient here is face down on the table and you have the bottom of her spine in here. So there's 12 thoracic spines joints up in there. So we're going to say this is 10, 11, 12. Ribs come off of here all the way up to her neck, just like that. Then after that, we have your lumbar spine. There's 5 of these in here. 1, 2, 3, 4, 5. And this joint in here is what gets out of whack. Now, we see this a lot in golfers or people gardening, something with flexion and rotation, so snow shoveling injuries. What is usually the culprit is the joint between these muscles, the joint between these bones in here, or the muscle that comes through here, and this is called your QL or your quadratus lumborum. This gets all tight when this gets rotated, hiking the patient's hip up. They can have pain in here, even down through the SI joint in here. If you look at our SI joint videos, we actually go through that later on. So we'll show you a treatment in a second, but essentially the TL, QL are basically the same thing. Sometimes people a little bit more muscle involvement, sometimes a little more joint involvement, but usually the pain is low middle back with a little bit of radiation or something coming down into the hip.
Okay, so let's recap. The human spine has 12 thoracic vertebrae that make up the middle back and 5 lumbar vertebrae that make up the lower back. The TL, or thoracolumbar junction, is the transition joint between the middle and lower back. This joint can become dysfunctional and cause pain here, or radiate downwards, even as far as the top of the glutes. When the joint acts up, the QL muscle can also become tight and contribute to the pain. The QL muscle attaches from your lowest rib into the top of the pelvis and connects to every one of the 5 lumbar vertebrae along the way. When this muscle gets tight, it's easy to see how it can completely lock up the lower back.